Hello, how is everyone doing? This is Dr. Fran. I hope that you guys are doing well and enjoying this beautiful day. I just wanted to ask a question. So, if I was to ask, when was the last time you had a physical checkup? If I was to just, throw a general question out there, when was the last time you had a physical checkup? A large portion of people would say they had their checkup within this year, within the current year. And if I was to do a follow up and say, well, why did you have a diagnosis? Some people may say yes, but some people would say no, it's just routine. It's just a routine checkup. I go once every 6 months, or I go annually to get, my routine checkup. Now, if I was to ask another question, when was the last time you had a mental checkup? When was the last time you went and saw a therapist just to do, maybe like talk therapy? Some may respond and say, why? Why do I need to do a mental checkup? There's nothing wrong with me mentally. I'm fine. Well, I think we should know by now, the same way that we do our annual and our routine physical checkup, it is necessary that we do mental checkup. That's the reason why it's called mental health, mental wellness. It is maintenance. Doing a mental checkup does not mean that you have a diagnosis. Just like doing a physical checkup does not mean that you have a diagnosis. It is essential that we do both. One body comprised of mind and body. So we need to make sure that both are well so that, they can function holistically. There are times in life where we may have experiences that may cause us to feel depressed or may cause us to feel anxious. That does not mean that automatically you have a depression diagnosis or you've been diagnosed with anxiety. Once you are managing that successfully, there's various ways on managing periods of depression. Like sometimes some things may happen, you may lose a job, so you may be temporarily depressed, and there are things that you can do to manage your depression, or there are things that you can do to manage your anxiety for that short-term period of time. It does not mean that you have a diagnosis. It just means that it needs to be managed, and the appropriate things need to be done so that you can overcome that period in life. Just like, for example, you go and you get a physical checkup and the doctor tells you, hey, your cholesterol is high. There are things that you need to do to manage it so that you can reduce your cholesterol. So the same applies. The same applies to mental health and also physical health. So we need to share this information and let people know, those who are not aware as yet, that all of us need to come together in breaking the stigma on mental health. We need to come together and breaking the stigma, because truth be told, it is killing us. It is killing many. It is killing many because many do not have that outlet. Many suffer in silence, and therapy is just one outlet. You're not internalizing your feelings. You're not internalizing your emotions. When you're going through that short-term period of depression, you have an outlet. You have someone that you can talk to, as opposed to internalizing it and keeping them bottled up, which can lead to long-term depression or long-term anxiety, and then it turns into a diagnosis. Okay, so mental health, physical health, we need to manage both. We need to manage both instead of waiting until it turns into a diagnosis. So please share this information. I hope that you are well. I hope that you take time to enjoy this beautiful day. Take care and be well.